It's my feel-good breakfast show.
It is your feel-good breakfast show, and the pandemic has really highlighted the important role that pharmacists play in the public health sector, both in South Africa as well as internationally. Now, we regularly see advice from our local pharmacists, so when it comes to iron deficiency, it's certainly no different. Now, we are joined by Dr. Sham Moodley this morning to talk about iron deficiency in the pharmacy and also the critical role the pharmacist plays. Dr. Sham Moodley, so good to be able to connect with you this morning.
Thank you very much, and I'm glad to be here. Thanks for inviting me.
Let's get straight into it. Why is education and awareness around iron deficiency anemia so important for pharmacists?
I think the pandemic has highlighted the critical role that the pharmacists have played, especially around treating patients at home through these 4 waves that we've had, together with administering of the vaccines. So there are multiple conditions that patients would normally walk into a pharmacy and ask for advice from the pharmacist. They see them as a hub of knowledge, a hub of healthcare advice, and they get it for free most times. So I think it's important that we continue with that and have the pharmacists understand the complexities of iron deficiency and be able to advise patients when they do come to seek that information. Remember, a patient will never walk in and say, I'm iron deficient, but they will outline a series of symptoms which the pharmacist therefore needs to be aware of, and it's critical that they pick up on those symptoms. A simple thing like a headache might actually be connected to an iron deficiency. So it's important that those patients are identified so that we can start to provide the correct amount of care for them and also place them in the right path towards being tested and being treated. I think the other healthcare professionals, especially in primary care, where in South Africa iron deficiency is really high up there, they need to be aware of it as well so that we could continue to pick up and provide adequate treatment for this.
Let's elaborate on that signs and those symptoms. What signs and symptoms are there that a specific patient is at an increased risk of iron deficiency anemia?
So I think the best way to explain this is maybe to take a typical patient that might walk in and have a conversation with the pharmacist. So a young woman that's really active normally would walk in and explain to the pharmacist that she is really tired, having difficulty coping in a full day at job level, or maybe she's exercising and in the gym she can't do what she did before. There's a lack of energy, there's a lack of concentration at home and at work. She might be complaining of a headache, and sometimes it's even at a point of where she might have a fainting spell, for example. So these are all symptoms that are important for the pharmacist to understand and to be aware of so that they can pick up and ensure that we provide the correct treatment options for this patient. So there are other circumstances where we need to be aware of the fact that there might be increase in iron demand. Pregnancy is one. The other is if you have a mum that's breastfeeding, there's an increased demand for iron in that circumstances. Then there are other complexities where a patient might walk in and be looking for a simple thing like worm infestation treatment. And because of the absorption in the gut, because of the worm infestation, you might have decreased iron absorption. You might also see this with patients that are utilizing alcohol, for example. Absorption is impacted. Pharmacists that are working, especially in outlying areas, where the content of the iron in the food might be lower, that might certainly be a case to be monitoring and evaluating.
Let's talk about treatment options, because we've been able to identify that a specific patient now has iron deficiency anemia. How do we start and manage iron therapy?
So let's just get back to patient X that we were talking about earlier with all those symptoms. So the first option would be to send this woman for an iron test, just to make sure that we understand the complexities of where the problem lies. It might be the fact that her blood levels are a bit low. Also, there's iron being stored. So if the stores are depleted, we know where to start to treat. Gold standards for treatment would be to use iron as therapy, first-line therapy, and to ensure that there's sufficient time frame in starting treatment to ending treatment so that the patient gets back to normal. Their blood levels, and together with the iron store, are back to normal. The WHO has recommended 100 to 200 milligrams of iron supplementation, and I think the pharmacist plays a critical role in making sure that that process gets to conclusion.
Here's my other question for you, and maybe the last question I have for you. Why do you think modern preparations for iron are more effective at correcting iron deficiency?
So the modern iron provides better tolerability for the patient. That's important because if the patient cannot tolerate it, they will stop treatment. So this is a very important aspect of ensuring that they complete their treatment options. So the take-home message for today is that patients need to be tested and ensure that their treatment plan is well worked out with their pharmacist, and pharmacists have a really important role to play in that.
Dr. Sham, thank you so much for your wealth and knowledge around this topic. Of course, for you at home, everyone does get tired from time to time. We know this. But if you do feel exhausted every day, you may be suffering from fatigue, which is a symptom of iron deficiency. Now, if you are concerned about your symptoms, it's important that you find out with certainty whether iron deficiency is the reason by speaking to your doctor in order to work out what is causing your symptoms and also how to treat it.
1 in 2 healthy South African women suffer from iron deficiency. Speak to your healthcare professional about getting tested and treated for iron deficiency. Brought to you by FERRIMED.